Good morning, ladies and gentlemen, and welcome to this meeting of the Board of NHS England here in London. We are, as is always our custom, meeting in public. It's not a public meeting, but it's an opportunity, we believed, for our work to be under public scrutiny, so that in addition to members of the public who we welcome here physically in person this morning, we're also live streaming across the world the proceedings of the Board of NHS England. So a very warm welcome to all of those who are joining us. We do fundamentally believe, actually, that the public have a right, are entitled to understand how and why decisions are taken which affect the health and welfare of the population of England. This morning, the immediate context is the aftermath of the general election on the 7th of May, in which everybody is aware the NHS had probably the greatest political salience of any of the many issues that the political parties were contesting. And we are conscious also that throughout those discussions, the position of the five-year forward view that was advanced by NHS England jointly with the other arm's-length bodies was critical in trying to understand where investment needed to go and what the priorities needed to be for the NHS England in the next 5 years. And it was, we believe, important and highly symbolic that the Prime Minister's first public policy speech following the general election was alongside Simon Stevens in Birmingham and talking about the next phases of the five-year forward view, visiting one of the Vanguard sites, which is the location for one of the new models of care. What we, I know, feel is our obligation as the Board of NHS England is to ensure that there's clarity and stability around policy over the coming years so that we can give effect to the vision that we enunciated in the forward view. As always, the meeting agenda is in two parts. There's the public part of the meeting, and then at the end of this meeting, I will invite the board to resolve to go into private session. We only, in private session, will take business which, by reasons of its commercial confidentiality or other reason, could not sensibly be taken in public. Let me just, for example, indicate that this afternoon we will be spending some time looking at the current draft of our annual report and accounts, which can't be considered in public session because they're not to be publicised before they're laid before Parliament, which we're, I think, reasonably confident will take place sometime in July. We also take the minutes of some of the committee meetings. The one committee meeting that goes to the private session of the board is the Strategic Human Resources and Remuneration Committee, but I'm going to make an exception today. There is one item to which I would wish to refer in public, and that relates to the remuneration of the Chief Executive. When Simon joined us in April last year, he publicly made a decision that he would waive 10% of his salary. And despite my fervent discussions with him earlier this year, he has decided that he would wish to renew that waiver of the salary. And I just wish to record that as a matter of public record and as a quite selfless and I think highly symbolic gesture on his part. So Simon, thank you for that. We don't do all of our business in formal meetings around the board. We do have what we call development sessions, because what we try to do is to ensure that the board works as non-executives and executives in a tight partnership as we work up early stages of future business. And we yesterday had a development session in which we looked at how we might bring further papers to the board over the coming year relating to the taking stock post-election and the next steps that we needed to take in policy development. I should also stress that all members of the board are constantly engaged in work of committees and in events outside the boardroom itself. Finally, just to repeat something actually that I said in preliminary comments at the last meeting, which is that we do circulate all board papers electronically. We are so switched on digitally as a board, and this is both efficient and sustainable. But if you see members of the board referring to their iPads during the course of the meeting, it's because the papers are on here. We can not only receive the papers, but we can annotate them and write notes on them as we go. So just to assure you that Crazy Birds and Candy Crush and Angry Birds, isn't it? Yes, it's Angry Birds.
Don't pretend your ignorance, Malcolm.
Are not being played by members of the board whose whole attention is focused on the business of the board during this session. Okay, so that then brings me to the formal opening of the meeting. And I would like to just to assure you that no fire alarm is scheduled, and should the fire alarm go off, then you will be safely escorted from the building by our team. Secondly, to invite any declarations of interest in matters on the agenda that are not otherwise previously declared in registration. No. Thirdly, to report apologies for absence. Lord Victor Adeboali is not with us this morning, but I have a confession to make, which is that we owe him apologies rather than the other way around, because when we scheduled this meeting, we were aware that he wasn't able to make it, and we simply had to press ahead because of the lack of availability of suitable times. Next, to look at handling of the business, we have starred items which relate to reports of the committees. I haven't had any indication from members that have those items unstarred, so we shall take them as business, which is simply to be noted, unless anybody during the course of the meeting expresses a wish to the contrary. Let me then move to the next phase of the business, which is to consider the minutes of the board meeting from the 26th of March. Those minutes have been circulated. I've had no comments on them, so I ask you to approve them as an accurate record of the last meeting. Thank you.
There's an inaccuracy that I recorded as Moira Grant.
Oh, right.
What could have been?
Well, may I say how immensely flattered I am by that comparison, and how shocked you must be. But if we could record that Moira Gibb is indeed Moira Gibb, I'd be grateful. Apologies that wasn't picked up, Moira. Right. Can I also invite any matters arising from the minutes? I don't identify any matters that are not otherwise on the agenda. Okay. In that case, please may we move on to the Chief Executive's report. Simon, over to you.
Thank you, Malcolm. So I would just draw out, I think, 3 items of the written report here. The first would be, I think it is worth just spending a moment looking back at 2014-15 in terms of the operations of NHS England. Secondly, a few headlines from the work underway to conclude the 2015-16 commissioning round. We'll talk more about that later on in the meeting. And then thirdly, since we last met, we have published our business plan for this coming year, setting out our 10 overarching objectives, and it would be worth just briefly reflecting on those. So obviously in terms of 2014-15, we will be publishing our annual report by the end of July, but as the board has seen through the course of the year, 14-15 was a stretching year for NHS England, our second year of operation, but nevertheless I think a lot that we can feel good about. I would group the work of the organisation under 3 broad headings: ensuring performance in 2014-15, setting strategic direction for the NHS over the coming 5 years, and improving our own capability and the change ability of the system as a whole. In terms of the 2014-15 outturn then, as everybody knows, there were real service pressures right across the National Health Service, strong demand pressures, strong pressures on providers. Despite that fact, fundamentally, performance levels remained good. We obviously worked closely with the Department of Health Treasury to secure additional funding during the course of the year to make fairer allocations as a board to CCGs, halving the number of CCGs more than 5% under their target share, 34 to 17. We met our overriding financial duties, as Paul Baumann will report in a moment. We took, I think, important steps to devolve power and promote autonomy across the National Health Service, with 151 CCGs getting more influence and control over the way in which primary care services were organised, the groundbreaking partnership agreement with Manchester, and the launch of integrated personal commissioning to put more hands into the power of patients and their families. So alongside that, the first steps on strengthening primary care, recognising this is going to be one of the key things that we have collectively got to put our energy into. We, since our last board meeting, have made the first set of allocations for GPs across the country from the £250 million premises and infrastructure investment fund. And you remember we've got a further £750 million that we're going to be able to invest over the next 3 years to help strengthen general practice, on top of the other work that we're doing as part of the 10-point plan with the Royal College of GPs and the General Practitioners Committee. We stabilised specialised commissioning during the course of 2014-15 under the leadership of the new Specialised Commissioning Task Force, and managed the Cancer Drugs Fund, various other high-profile commissioning decisions, recognising, I think, that we've still got further work to do during the course of 15-16. We began the move towards mental health parity of esteem, using ring-fenced money for investment in child and adolescent mental health services, eating disorders. We set clear direction for the NHS for 15-16, expecting CCGs to increase their investment in real terms in mental health services in each area, consistent with the overall funding growth that they themselves were getting. And when we talk later about the assurance process we're using for CCG investment decisions for 15-16, we can update on where that has got to. Significant progress on the technology and information agenda, patient and public involvement, the NHS Citizens programme. So in the round, I think a lot of good things in the sort of here and now during the course of 14-15. Over and above that, obviously the second big thing we did, which really bears no repeating, is with partners establish the strategic direction for the National Health Service for the next 5 years. And as you just said, Malcolm, the broad consensus on display from all political parties during the election campaign, and the clear message delivered by the Queen in the Queen's speech yesterday that it's game on as far as the 5-year forward view implementation is concerned, I think is a testament to the work of a broad base of stakeholders right across the health and social care system, and with voluntary sector and community partners as well. In terms of capability building, we have, over the course of 2 years, cut the running costs of the commissioning system in England by over 30%. At the same time, we have sought to better align the matching of talent and effort to core priorities, including, under your chairmanship, reshaping the committee structures and the workings of this board. We have set more emphasis on the need for a more diverse workforce across the National Health Service, with the implementation of the Workforce Race Equality Standard under the NHS Equality and Diversity Committee. And again, we know much further work required there. Ed's review on the future of leadership and improvement, which will be published shortly, is going to, I think, set a direction of travel for improvement that has perhaps been too diffuse in terms of the architecture and institutional structures over the last several years, and we know we need to correct that with Monitor, TDA and others. So all of which is just to say that it's easy in the heat of battle to lose track of the fact that we've come an enormous distance over the course of the last year, and I just want to put on record my thanks to the executive directors and all of the employees of NHS England for those achievements during what has inevitably been a difficult year, given the pressures, the service, the running cost reductions, and in some cases the redundancies that we have had to embark on. The second thing I would just touch on then is the state of play with the annual commissioning round. And as I say in my report, and as we'll hear later from Paul and Barbara, we are, with our CCG partners, having to strike a pragmatic balance between the desire to invest in services that offset the continuing increases in emergency demand and elective activity, on the one hand, and on the other, providing realistic upfront commitments to providers as to the volume of patients they're likely to need to treat so that they can make good capacity planning decisions for the year. We think we are striking that balance with an assumption of activity growth of in the 2 to 3% range, which will obviously vary different parts of the country. Those activity growth numbers are probably not yet fully reflected in providers' own plans and finances, so we'd expect to see some further improvement in their position as that happens. But all of this is obviously playing out against the backdrop of a very difficult situation in provider finances across the National Health Service. I think Monitor's board meeting today, TDA's last week, shows substantial overspending by NHS providers during the course of 14-15, and I think it is our collective responsibility, including Monitor TDA, the Department of Health, NHS England, to help providers now manage the source of those cost pressures. And of the 822 million net overspend by providers, that is more than explained by, in fact, one single factor. There are other things going on as well under delivery of planned efficiencies, but the single most important factor is that, as the papers, the public papers for Monitor and TDA show, NHS providers overspent on temporary staffing by £1.4 billion in 2014-15. So, for example, the FT sector was budgeted to spend £770 million on temporary staffing, actually spent £1.77 billion on temporary staffing. So we, I think, have got a clear agreement across the sector that concerted action, collective action on temporary staffing to convert temporary staffing into permanent jobs, to ensure that NHS hospitals are able to offer the sort of flexible employment opportunities that will be attractive to staff, combined with continuing work to increase the output from nurse training and to ensure retention. This workforce piece is going to be absolutely essential to helping providers manage their costs this year and next, and we expect to see a programme of action launched shortly to do just that. Then thirdly, alongside the 14-15 look back and the 15-16 commissioning round, obviously we have, as I said, published our business plan. You'll see the last page of my report identifies the 10 key goals for the year that the board approved at our last meeting, and we are now mobilising around this, particularly on cancer and mental health through the two task forces which have been established. We expect the cancer task force to be in a position to publish its work this side of the summer break. Mental health task force probably in the autumn. Jane is going to describe to you the next steps of the work on learning disabilities, and we are now ramping up for the diabetes prevention and obesity work, which again has got support from across government for some of the broader determinants that are obviously not within our direct control. On urgent emergency care, primary care, elective care, specialised care, the care redesign, the four priorities there, we will bring to you specific proposals over the course of the next 3 board meetings, and we will have a chance to talk about some of the enablers later on in this session. So why don't I stop there, Malcolm, and take any questions that arise?
Yes, by all means. We'll be coming back, as you said, to the commissioning round discussion, but if there are questions on other parts of Simon's report, please may we take them now? Well, the chairman should never lose the opportunity that silence gives to press on with business. So may I ask us please to note the Chief Executive's report.